Good afternoon, you guys.
Good afternoon.
How are you guys doing?
Good.
That's good. My name is Tanya Stansel, and we are here to discuss HIV and AIDS. How's that sound?
Okay.
That's good. And today, this workshop is only for teenagers, so you guys don't have to worry about adults or feeling uncomfortable. There's no stupid questions and no stupid answers. We're all here to learn, okay?
All right.
All right. So the first thing that we are going to do is an icebreaker called Skittles. So I'm going to give you one Skittle. I'm going to give you one Skittle. And I'm going to take my one Skittle. And what we're going to do is we're going to introduce ourselves. So I would say my name is Tanya, and then say what color Skittle we have. I have a red Skittle. Then read the question that goes with the color. What is your dream vacation and why? And then just answer it. So my name is Tanya, I have red. And the question is, what is your dream vacation and why? My dream vacation is to go to Spain because while taking Spanish in high school, my Spanish high school teacher discussed Spain a lot, and I just became intrigued with the country and the landscape and wanted to go. So I've wanted to go to Spain since I took high school Spanish. So then next you can go.
My name is Jelani, and I got the blue skin. The question is, would you rather run a marathon or ride a bull? And I would say ride a bull because this seems more like adventurous than riding a marathon, and I don't like to run.
So are you an adventurous person?
I guess so. Yeah.
Well, that is very interesting. Thank you for sharing. What color do you have?
Okay, my name is Kathleen. I'm a green skill. And question two, what's your favorite singer? I would say my favorite singer is Lady Prince because he's a wide variety of stuff and he's really here. And he has a lot of very interesting style.
Okay, well, thank you guys for sharing. I'm glad to learn a little bit of something about each one of you. The next thing that we're going to do is a pre-test. And I have the questions up here, but I'm also going to give you a paper copy. Don't write your name on here, just I'm going to give you a number, and you can write the number up here. And then just answer the questions. And the reasons for doing this is not only to see how much you know about HIV, but to also give you guys a glimpse of what we're going to be discussing while we're in the workshop. And then after, I'm going to give you number one and give you number two. And then once you're done, you can just flip the pretest over. Okay, so we're going to get started. So first, what is HIV? What do you guys think that HIV is? What do you think?
HIV is a virus that gives you AIDS.
Okay. Yes.
And I think HIV stands for Human Immunodeficiency Virus.
You are correct. Yes, that's both correct. HIV is a virus that stands for Human Immunodeficiency Virus. And it is the virus that's transmitted from person to person that causes AIDS. And if someone is infected with HIV, they're said to be HIV positive. And does anybody know what AIDS is? Not sure? Maybe?
I was just gonna repeat but you can get it from HIV.
Oh, well, you can get it from HIV. If AIDS stands for acquired immunodeficiency syndrome, and someone does not develop AIDS unless they have been infected with HIV. So if you have not been infected with HIV, then you don't develop AIDS. And AIDS is the end syndrome of being infected with HIV. So people can live a long time with HIV before developing AIDS. There are people who have been living with HIV for 20 to 30 years. And with the medications that are available now, people are definitely living a long time with HIV. Yes?
It says the end syndrome of being infected with HIV.
Yes.
So like, is that, what is the end?
Well, with AIDS, what usually happens is that there are cells within the body called T cells, and those are the cells that HIV targets. So HIV will infect the T cells in someone's body, and the virus will kill those cells. So when a lot of those cells are killed in the body, they become very low, and then the body is unable to ward off what's called opportunistic infections. Those are basically infections that basically take the opportunity of someone's immune system being low. And so with having very few T cells and getting a lot of opportunistic infections, that's when someone is said to have developed AIDS. And usually when someone is said to have died from AIDS, a lot of times what has happened is that they have died from the opportunistic infections that they're getting. So, does that answer your question? All right. Did you have any questions? Okay. So how is HIV transmitted? How do you think HIV is transmitted? Through blood? Any ideas?
By touching?
By touching? Any more ideas? Sharing needles, okay. Well, one way is through sharing bodily fluids, and there are certain bodily fluids that can transmit HIV. The first is semen, then blood, like you said, breast milk, vaginal fluids, or rectal fluids. And HIV can also be transmitted through childbirth. So when a woman has a baby, the baby can become infected with HIV. So the bodily fluids are shared in certain ways. And other than you said you thought sharing needles, are there any other ways that you think the bodily fluids can be shared? Any other ways?
Kissing?
Kissing? Okay, we'll see. Vaginal sex, anal sex, or oral sex can transmit these fluids. Sharing needles, like you said, can transmit HIV, and breastfeeding. And one thing about childbirth and breastfeeding is that if a woman that's pregnant has HIV, if the mother takes the HIV medications that her doctor's given her during pregnancy, and the baby is given medication for 4 to 6 weeks after it's born, the likelihood of the baby contracting HIV is greatly reduced. So how is HIV not transmitted? Any ideas? Yes. Through air? Okay. Any other ideas? Not sure? And that's okay. You're right, it cannot be transmitted through air, water, pets, insects. I'm going to stop here for a second because for a long time people thought that HIV could be transmitted through mosquitoes. Have you guys ever heard that? That you could get HIV from mosquitoes? Well, HIV, since it's a human virus. That's why it's called human immunodeficiency virus. Cannot be transmitted by insects, only through humans. So mosquitoes can't transmit HIV. So sweat, saliva or kissing, tears, toilet seats, sharing food, sharing drinks, or shaking hands. Okay, so these are all ways that HIV cannot be transmitted. So why do you think that HIV is not transmitted in these ways? Do you have any ideas?
Because the virus has to be in a human.
Okay. Okay, any other ideas? No? Okay. And you're definitely right. HIV does not live outside the human body. So once it leaves the human body, it dies fairly quickly. So that's why touching and that sort of thing cannot transmit HIV. It does not live on surfaces, it does not live on skin. So again, cannot be transmitted through touching or anything like that. If a bodily fluid gets on a surface like a table, it dies very quickly. So again, it's difficult to not transmit HIV. It's difficult to transmit HIV if you're not doing certain activities that we're going to discuss later. It does not reproduce itself or make copies of itself outside the human body. So when it's inside the human body, it will make copies of itself. And once it leaves the body, the human body, it's not able to do that because it's a human virus. It needs to be inside the human to be able to replicate itself. Any questions? Okay. So, who do you think gets HIV or can get HIV, become infected with HIV? Who do you think?
Anybody?
Anybody? Do you have any ideas about who can get infected with HIV?
Everyone.
Everyone? Okay, both of you are right. Anybody can contract HIV. Why do you think that is? Any ideas?
People are pretty much the same on the inside.
Yes, yes. So it's about behaviors and not specific people. Like you said, everybody's the same on the inside. So HIV doesn't care about how much money somebody has. You could be rich or poor. It doesn't care if you're black or white. And it doesn't care if you went to high school or got your PhD. If you do certain behaviors, you can contract HIV. So we're going to talk about what some of those behaviors are. Or we've already talked about what some of those behaviors are. But if you don't participate in those behaviors, then you can't contract HIV. So, in the United States right now, or at least in 2015, there were over 1.1 million people living with HIV. Does that sound like a lot of people with HIV? Does that number surprise you guys, how many people that is? Okay, yeah, and then that could be, that is a lot of people. How many people do you think that are infected, of those 1.1 million people infected? Do you think all of them know that they have HIV? No. How many people of that 1.1 million people do you think do not know that they have HIV? So that comes out to be about 170,000 people who don't know that they're infected. So because they don't know that they're infected, they don't know that they need to first get treatment and take precautions to help protect other people. And that's why HIV keeps being transmitted. Any questions about that? Okay, so do you think that only adults get HIV, or do you think youth and teenagers can get HIV? Yes, youth and teenagers can get HIV as well. So if you had to guess, how many people or how many teenagers do you think get HIV in 1 year? How many people would you think that like just a couple, a lot?
Well, I'm gonna say like 200,000 from out of the 1.1 million.
Okay. Okay. Well, talking about just the people who found out that they had HIV in 2015. So not talking about the total 1.1 million, but just the people who found out that they had HIV in 2015. 1 out of 5 of those people were between 13 and 24. Does that surprise you guys? That's like 20% of the people that got diagnosed in that year were teenagers or young adults, people in college. Do you think all of the teenagers and youth and young adults that have HIV know that they have HIV? No. And in fact, 51% of youth and teenagers, young adults that have HIV do not know that they're infected. So that's a little over half of the youth and teenagers don't know that they're infected. So teenagers are, more than half of the teenagers that are infected are prone to transmit to somebody else because they don't know they're infected themselves. And most of the youth and teenagers that become infected are infected through sexual contact. So does that surprise you? You guys? Not really? Not really? Okay. So what do you think puts you at risk for HIV? Yes?
Using drugs or alcohol.
Using drugs or alcohol?
I was gonna say being uneducated.
Being uneducated? Those are both very good answers, because even if it's not HIV, it could be something else, another disease, another topic. The more educated you are about something, the better you are at protecting yourself, making good choices, right? So that's a good answer. So first thing you can do is not using condoms, or one thing that puts you at risk for HIV is not using condoms the right way every time you have sex. So if you are only using condoms every once in a while, or you're not really sure how to use them, or you're not using them the right way every time, that can put you at risk. And why do you think that can put you at risk? What was one of the bodily fluids that can transmit HIV?
Vaginal fluids.
Vaginal fluids, that's one. Do you remember another one that can transmit HIV? Another one is semen, or rectal fluids. So just depending on what type of sex it is, those 3 fluids can transmit HIV. So if you're not using condoms every single time the right way, that will increase your risk of being infected with HIV. So having sexual contact with multiple partners, why do you think that that one will make you more at risk? Yes.
It causes higher probability.
Yes, high probability is a numbers game. So the more people that you are having sex with, the more exposure or possible exposure you have to HIV. So that will put you at higher risk for contracting HIV. It's kind of like, with the lottery, if you buy 150 tickets, you have a much better chance of winning than if you buy just one ticket. But of course, when we're talking about HIV, you don't want to increase your chances there. You want to decrease your chances. And like you said, drugs and alcohol. And I know a lot of times people hear about the intravenous drugs or the IV drugs and assume that that's the only way that you can contract HIV. Do you think that's the only type of drug that can influence whether you get HIV?
Well, I think pretty much like all drugs and alcohol change like, what was I gonna say? Yeah, like perception and like inhibition, I guess.
Yes, and you are absolutely correct. It doesn't matter if you are shooting up drugs or if you're using a drug like marijuana or drinking alcohol, it will all change your mental state, which if you're high, you're not necessarily making good judgments. And so if you're using drugs or alcohol, you may decide to shoot up drugs and share needles with somebody, or you may decide not to use condoms or have sex with several different people. So it's definitely not using drugs or alcohol is important when talking about risky behaviors for HIV. Getting other STIs, which are sexual transmitted infections. How do you think that factors into someone's risk for HIV going up?
If you already have STIs, then obviously you're not doing something right.
Exactly. If you've gotten one sexually transmitted infection, then more than likely you're not using condoms correctly. Maybe you're having sex with several different people. So if you get one sexually transmitted infection, you're likely to get others sexually transmitted infections. And sometimes sexually transmitted infections will piggyback off of each other. And of course, they're all transmitted through unprotected sex. And I put this in, this isn't necessarily something that you guys as teenagers will necessarily have to worry about, but people such as nurses, doctors, and police can sometimes get infected if they're stuck by mistake with an infected needle. It is possible for them to be infected with HIV. So how do you think that you guys can protect yourself from HIV? What are some ways?
Stay away from drugs and alcohol.
That is a good one. Do you have any ideas? Make good informed decisions. That's definitely a good one.
And to stay educated.
To stay educated. That is true. And sometimes new information comes out, so it's important to, just because you've come to this today, it's important to still ask questions. But sometimes new things come out and new information comes out. So just make sure that you're always asking questions, and that way you can make sure that you're still protecting yourselves, okay? So, one way to protect yourself is is, like I said, condoms are very important. Using condoms the right way every time you have sex is important. And it's important to remember every single time the correct way. It's not going to do any good to use a condom sometimes or only with certain people. Hopefully the number of people you're having sex with is a low number, but they have to be used the right way every single time, okay? And another way is to limit the number of people that you're having sexual contact with. And that doesn't necessarily have to mean during a short period of time. It doesn't have to mean that you have one boyfriend now instead of two boyfriends. Of course, that's one thing. You know, you shouldn't be seeing more than one person or having sexual contact with more than one person during the same time, but over your lifetime as well. Because, like I said, it's a numbers game, and you do not want that number to be a high number, because it puts you more at risk for contracting HIV. Don't use drugs or alcohol, because like we just discussed, you know, it changes your mental state. You might have, your inhibitions might be affected, and so all of a sudden you feel better about making choices that you normally would not have made that put you at higher risk for contracting HIV. Getting tested for HIV. And this is important because when you get tested for HIV, if you're negative, then you can move on from that point and take certain actions to ensure that you stay negative, like making sure that you have condoms or not using drugs or alcohol. And if you're positive, then you can go get treatment. And so what places do you think that you can get tested if you decide you want to get tested?
The doctor's office.
You can go to the doctor's office. Do you have any ideas? The health clinics, yes. Any other ideas? Okay, well those are definitely options. You can also go to the health department. A lot of times they'll do HIV testing for free. There's also organizations that go out into the communities. So they may go to churches or parks, or sometimes the bus terminal downtown, and do HIV testing for free. And so there's always ways to get tested for HIV. And if you have participated in an activity that puts you at risk, so let's say that the other night someone had unprotected sex with someone else, and they're not sure whether they have HIV or not, they can go to the doctor or a clinic or even maybe a hospital, and they can get what's called post-exposure prophylaxis. And what that is an HIV medication that they can take for a certain amount of time, and that will reduce the risk of them being infected with HIV, yes.
Is that one of the medicines that they use for pregnant women if they have HIV?
It could be one that a pregnant woman takes. There's a lot of different HIV medications now, and so usually someone with HIV will be put on 3 different medications, and it could be all in one pill or 3 different pills. But it could be one that a pregnant woman would take. Each person's medication system would be unique to them, because some medications might work for one person but not someone else, and that person might take medications that work for them but not somebody else. So like sometimes with someone with high blood pressure, you know, they might take 3 or 4 different pills before they find something that works for their blood pressure. So it's the same thing with HIV. Sometimes someone can find a medication that works perfectly the first time, but sometimes it might take 2 or 3 tries before they find something that works for them. So if someone routinely participates in activities that puts them at risk for HIV, they can get what's called pre-exposure prophylaxis, which is basically like if someone is maybe addicted to an HIV, an IV drug, and so they're using needles and sharing needles, and so they're doing that routinely, they can get what's called pre-exposure prophylaxis, which reduces their chances of being infected with HIV. So if someone's taking that every day the way the doctor says, it can reduce their chances of being infected by up to 90%. So one thing I wanted to take a couple minutes to talk to you guys about is with condoms, it's because it's so important. You know, a lot of times youth and teenagers might feel uncomfortable with navigating condoms, buying them, having their partner use them, that sort of thing. So one thing I want to stress is that it's because it's important to use condoms the right way every time someone has sex, that sometimes it might be good to either talk to your parents or go to your doctor's office, talk to a nurse, or even go to a clinic such as Planned Parenthood. They have people there to kind of talk to help teenagers navigate the peer pressures of relationships and being comfortable enough to get condoms. Planned Parenthood also has condoms that they can give to people, including youth. The health department has condoms. Organizations that go around doing HIV testing a lot of times will also have condoms to distribute. So there are ways to get condoms, and so it's really important, especially since we saw that youth and teenagers, the most common way that they get infected with HIV is through sexual contact. I want to make sure that you guys know that condoms are very important to use every single time the correct way, and that it is possible to be able to get them, and sometimes even for free from like Planned Parenthood or different organizations that are out distributing them. Okay? Any questions, you guys? No? Okay. So do you think that there is a cure for HIV? Yes?
There are treatments, but not a cure yet.
Yeah, and what do you think? Okay, so there is not a cure for HIV right now, but like you said, there are medications for HIV. So there is research being done for to try to find a cure, also to try to find develop vaccinations and that sort of thing. But right now, there's no way to cure HIV. Once people find out that they're infected with HIV, they have to take medications for the rest of their lives. Just kind of like diabetics have to take medications for the rest of their lives. Or people with HIV also need to take medications for the rest of their lives. And so if they take the medications as prescribed, the medications will reduce the amount of virus within the person's body. And if the medication is effective enough, it will bring the level of the virus down to what's called undetectable, which means that the virus is difficult to find within the body. The likelihood that that person will transmit HIV to someone else is lower. So that is what's called prevention through treatment, because if someone who is HIV positive is in a relationship with someone who's HIV negative, and the HIV positive person has become undetectable, their partner has a lower chance of being infected. So that's prevention through treatment. So, do you think that you can tell whether someone is infected with HIV? No? What do you think? No? Okay. And that's true. You cannot tell whether someone has HIV or not. It's just like, if someone's walking down the street, you can't tell whether they have high blood pressure or asthma or diabetes just by looking at them. If you're walking down the street and somebody falls out in the middle of the street, then obviously something's going on with them. But even with that, it could be diabetes, it could be dehydration, it could be anything. So there's no way to just look at somebody and tell whether they have HIV. Then how do you know if someone has HIV? So the only way, the one and only way to know whether someone has HIV, whether it's the individual themselves or somebody else, is if that person has been tested. And so even though with some people may have flu-like symptoms when they're first infected, but not everybody gets that. And so the only way to know one way or the other is by getting tested, yes.
What is they do to test if you have HIV?
Well, there are a couple ways to be tested. You can get a blood test, or you can get an oral test. And it's possible to do like a rapid test where you can find out within, I believe it's 20 minutes, or the blood test can take a couple days to find out. Yes.
Is the blood test more accurate? Does it take longer?
Well, that's not why it takes longer. I've seen a little bit of information on whether one is more accurate than the other. There are better tests coming out, and I could go into like the type of test and everything, but that's a little bit more than what we need to get into right now. But with the blood test, I believe that they're just a little bit more accurate, but the oral tests are still very accurate and they're useful.
Well, how many more people do the blood test as opposed to the oral test? How does it choose the one or the other?
Well, it just depends on what kind of situation it is. If somebody goes into a clinic and they know that they want the blood test and they know that it can take a couple days, then they may just go ahead and choose to do that. If there's a reason, if somebody may have a reason to want to be tested and know, maybe they have been participating in activities that they know put them at risk, and now they're nervous and want to know immediately, so they may choose like a rapid test. If an organization is going out in the community and they're testing a lot of people that may want to know immediately, maybe they're in a community where they're not sure the people are going to come back for the results, so they may do the rapid test. So it just depends on the situation. I don't know if one is more popular, but there's just different reasons for doing one or doing another. It just depends on the person. Does that answer your question? Yeah. Okay. Did you have any questions? Okay. What we're going to do now is we're going to look at, I'm going to show you a picture, and I'm just going to give you a second, about about 2 seconds to look at this picture. So when you look at this picture, you've got to focus on the picture, okay? Because you're only going to have a couple seconds, okay? So what did you guys see in that picture?
I saw two people looking at each other.
Two people looking at each other. What do you think you saw? Okay. Okay, so how many people do you think you saw?
Two.
Two. And how many people do you think you saw? Three? Okay. And why do you think that we're doing this activity?
Because you can't look at something for just a second and figure out everything about it.
Right. Right. What do you think? Same thing. Yeah, that's true. And what happens if everybody just walks around and makes snap judgments about other people within 2 seconds? Do you think that they're going to get everything right about everybody? Right, right. So what's important is that people take the time to focus in on people and learn about them instead of just making snap judgments about people, right? So I could look at you and say, she has a jean jacket on. I bet you she's in the jean jacket game. Are you in the jean jacket game? So I would be wrong, right? And I can come and say, oh, she's got gray sneakers on. I bet you she runs track. Do you run track? So I would be wrong, right? So you can't just go and make snap judgments about people just based on something just like that quick, right? Okay, so what we're going to do is go back and look at the pictures. So both of you guys saw the old woman here, right? Okay, then both of you saw the old man. Okay, so who saw the person in the old man's ear? Did either of you see that? Okay, right, so if you just made the snap decision or made a snap judgment, you would have missed that, right? And did either of you see this man here with the sombrero and the guitar playing? Right, so if you made another snap judgment, you would have missed that. And what about this person in the woman's face right here, and the hat and holding up something over in the woman's forehead? Did you guys see that? You saw that one? Did you see that one? Okay, so that's why it's important to take the time to focus in on people and learn about them and not making snap judgments about people. And whether they have HIV or not, or something else or not. Because if you just make snap judgments and don't actually look at the person and learn about them, it can be very easy to miss important information about them, right? Okay. So the next thing that we're going to talk about is HIV stigma. So do you guys have an idea of what stigma is? Yes.
Stereotype or idea associated with something, an idea of connotation.
It's a stereotype or judgments about a group of people or anything, and it's got a negative connotation, right? And that's true. And one thing about HIV and HIV stigma, especially with youth, is that, and with adults, but with youth may experience stigma when they are diagnosed with HIV. And even if they're not diagnosed with HIV, but they're scared, maybe they've been participating in activities that put them at risk, they may be scared to go get tested because what happens if I find out that I'm positive? What if people find out that I'm positive? So even if you're not diagnosed with HIV, there's still the stigma around HIV, and that could cause whether somebody, youth, adults, want to get tested for HIV because maybe they're too scared to find out. And if they find out that they are HIV positive and been infected, sometimes they don't want to get treatment because what happens if somebody finds my medications and they see what kind of medications I have? You know, so stigma can really impact both whether people get tested and if they get treated, and all that affects whether HIV is transmitted. Because if people aren't getting tested and don't know, or they're not getting treated, so their levels of virus will go to undetectable, like we talked about, then that all affects whether HIV continues to be transmitted, right? You guys get that? Okay. So stigma may be individual. So like I said, someone, a youth, adult, they may feel embarrassed. I'm embarrassed because I had sex with 5 people, or I'm embarrassed because I did a lot of drugs. You know, they may feel shameful, or they may feel fear because now they don't want to get tested and find out whether they've been infected or not, right? So the stigma may be interpersonal. So they may feel stigma from their family and friends because maybe they're afraid their family and friends are going to judge them and make fun of them or put them out of the family, or that whatever fears that they have about judgments that their family and friends may make. The stigma may be community level. You know, maybe they don't know what resources are in the community. Maybe the community doesn't do a good job of letting people know what's available. Maybe they don't have the proper resources for people to go to. You know, and with youth, you know, maybe the community doesn't know how to reach youth. You know, a lot of times youth may not have their driver's license, so they can't just hop in a car and go to Planned Parenthood or the health department or the doctor's office. So maybe organizations don't have things set up for youth to be able to go and get tested or get treatment or get education. So stigma may be community level. It may be at policy level within like the state, the county, a city, or nationwide. And it doesn't necessarily have to be intentional. Sometimes policies or laws that are made may have unintentional effects that may cause stigma. And so at the end of this, what's really important to remember and understand is that it's important to see someone with HIV as an individual and not the disease. So it's just like it's important not to see someone with diabetes as a diabetic, or someone with asthma as an asthmatic, or someone with high blood pressure as just somebody with high blood pressure. So it's important to see the person as an individual. So what we're going to do next is we're going to do a post-test. It's going to be the same test that you guys did before. So I'm just going to give you guys a minute or two to just go through the answers and answer them again. Same number that you put on the pre-test on there as well. Then you can just turn it over when you're done. question is, what is HIV? Yes.
The human immunodeficiency virus that causes AIDS.
Yes, and you are right. Give the girl a prize. And so, next question, true or false? You can get HIV by touching someone. False. That is false. So the next question, HIV only affects certain people. True or false?
False.
False. So, yeah, and anyone can contract HIV because, does anybody remember? Yes, the body is on the same, on the inside for everybody, and HIV does not care about people, it cares about behaviors, yes, yes. So the next question is, the only way drugs can impact you contracting HIV is if you use or share needles.
False.
False, that's right. I'm sorry, I just read the wrong question, but that's all right, we're gonna go with this. True or false, there is a cure for HIV, which is false, because there are medications but no cure, right? Okay, so then the next question is, the only way drugs can impact you contracting HIV is if you use or share needles, and you guys said false. And I got the wrong question again, I'm sorry. So there are ways to protect yourself from HIV, which is true, right?
Yes.
So what are some of the ways to protect yourself? So you remember?
Stay away from drugs and alcohol.
Stay away from drugs and alcohol. What are some other ways? Making good decisions. And using condoms every time the right way, yes. And no sharing needles, okay. So last one is when someone's mental state is altered, regardless of what drug it is, you can make bad choices, right? And so that is basis of today's workshop. Make good choices, make sure that you're educated, you keep asking questions, because new information can come out. And at the end of the day, try to protect yourself, right? Well, thank you guys for coming. I enjoyed doing this workshop with you. I hope you guys enjoyed it. Did you learn anything?
Yes, I did.
Yes. Well, thank you. Thank you guys for coming. Do you guys have any questions?
I just have a question.
Yeah, okay.
If you were undetectable, like, if you were taking your medicine to become undetectable, if you stop taking your medicine, will your numbers go back up?
It depends on the person. There's a good chance that they will go back up, which is why a lot of times doctors will tell individuals to make sure that they're taking their medications every single day, because if you're taking the medications every single day, then you're more likely to become back undetectable and stay undetectable. Also, sometimes if people are taking their medications all the time, what can happen is that the body can get used to the medications, and then the medications won't work so well, so then they have to switch medications and all that. And so when people are taking medications and they stay on medications and they're undetectable, if they keep taking them, then they're more likely to stay undetectable. And that's just better for them, whatever relationship that they're in, that sort of thing. So, does that answer your question? Okay. Do you have any questions? No? Okay, well, thank you guys for coming. I appreciate you you guys coming and spending this time with me.
Thank you.
All right.